Welcome to the Dr. Dana Show. Today we have an amazing guest. He's come all the way here from Las Vegas. He's been doing much work in the field of regenerative medicine. He's on multiple board of directors. He's one of the honest guys in this industry because obviously I think a lot of us understand there's a lot of money in this industry and a lot at stake. He's worked with exosomes, he's worked with stem cells, he's worked with adipose tissue, he's worked with placenta. So he's just a wealth of knowledge, and we're going to bring to you today Vince Liguori. So let Vince tell you about what's real and what isn't real in the regenerative medicine field. Thank you. Vince, pleasure seeing you here. Thanks for coming on today.
Okay, so I'll do the little intro. So my name is Vince Liguori. I'm the CEO of L2 Bio. It's a company that specializes in stem cell banking. We can talk about that later on. And Ageless Biotech, which is our phase 2B clinical trial, a 400-person multi-site clinical trial that's FDA-approved clinical trial. I think we're more progressive than most people. We're farther along for osteoarthritis of the knee using adipose-derived stem cells. And the next one is Cresca, which is a adipose-derived, kind of extracellular matrix that we have designed for cosmetic purposes. I mean, but it is a cellular-based product.
Can you tell the audience a little bit about what the difference between adipose and placenta, or basically, when this industry started, we heard about stem cells. That's all we knew about. And then we found, it's from placenta. Well, that sounds interesting. Sounds like those are nascent, very young, very powerful cells, and we thought they could do a lot in the human body. So how can the adipose work? How does it work? And how old are the people that the adipose is coming from, and does that matter?
So there's a few questions there. So let me touch on. So I don't want to make this a compliance show, but technically, to be compliant, the product should come from the human body in a general area and be reintroduced back to the human body.
Compliance means what exactly?
Meaning the FDA is okay with it.
Okay, so it's okay for doctors to use it?
Correct.
Okay.
So, but that would be, so for example, I won't pick on a product, but let's just say something, pre-birth. You would,
so placenta?
For that to be compliant, you'd have to show at your ripe age of 29 and a half that you're walking around at 29 and a half,
right.
And you have a piece of that placenta in your knee, and we're injecting back into that piece of placenta.
Interesting, okay.
So that's a very narrow, that's the FDA's interpretation.
Right.
And you would also have to put it on your labeling. This is what I'm doing with it.
Okay.
In general. Okay. Without talking about a disease or anything specific. Mm-hmm. So I don't want to go too fast and confuse people, but it's a really easy explanation. There's some of us, I have some more liberal interpretations, and so do many other people. But that's how they think. How's that sound? Now, the adipose-derived stem cells, the reason why we like them.
So they're coming from fat. They're coming from a person's fat.
Correct.
If that person is young, or does it matter the age where you're getting
For the most part, there's no real progression of cellular aging in the cells where we get them.
Really?
So
they don't age much?
Yeah, so let me explain. So we're looking, just imagine the collagen locks away these type of stem cells in like a time capsule.
Right.
So the difference is a fetus, we'll use a fetus as an example. If I pulled a certain amount of adipose from a fetus, let's just say 2 tablespoons and 2 tablespoons. The concentration of the stem cell viability, or the amount of stem cells that are the same or similar, would be 1,000 times higher in the fetus than a 40-year-old. Okay. Now, I haven't measured because we've never really
it sounds plausible, yeah.
taken from fetuses.
Because it's a new baby.
But we have done children at 16 and 17 and 20 over the years, and they do have a higher concentration. So somebody that's 80, it's better to get more fat. Okay. It doesn't mean we can't grow it, but we're looking for those cells. Now, the advantage of those cells is they not only tend to be younger, they have longer lifespans, and they survive better after implant. Where there are some problems with umbilical products surviving. Now, there's some great umbilical products like Morton's Jelly. We can talk about that later.
Right.
The audience may not understand. We can go into it slower, but that's not what we're here to talk
about. So right
now
we're just saying that the adipose cells, once they are used in the body, the human body, they will last a lot longer, and they're more hardy. They don't die as easily.
Correct.
When you're thawing them out, because a lot of these things have to be kept at a very cold temperature, and you have to defrost them, right?
Let me explain this to you real quick. So we've recently, and I'll release this to you because we just filed another IND for Crohn's disease.
What's the IND?
IND stands for Investigational New Drug. And there's a couple of reasons why we have some really good success. and we can talk about that later. I can even send you a video that will make you cry
Okay.
about how well this has worked. And
Yeah.
happens to be on my
We should put it
my
on the
nephew.
show, actually.
It's unbelievable.
Okay.
And I'm embarrassed because I didn't realize my nephew had such severe problems. So, I found out on
And he
accident.
healed, and everybody
I'll send you,
came
it's-
around him, and it was
it's
amazing.
unbelievable.
Okay, please
So,
do.
yeah,
Can
I'll
you
send
say
it
what
to
he healed from?
He has very bad Crohn's disease.
Oh,
In the
that's
trial,
true.
he
That
wouldn't
could be-
qualify because his colon is removed, his anus is detached,
Oh my goodness!
and suffered from side effects of Remicade and other drugs.
And now he's okay. He's doing really well.
It's unbelievable.
Like night and day.
I always say stem cells aren't magic. He went on there and said, I wasn't sure if he was messing with me. He said, my Uncle Vince says stem cells aren't magic all the time. It takes, whatever, right? Repeat treatment, a good doctor, the right cells. But to me, they're magic. And he looked at me like I'm an idiot. But it actually
amazing.
worked out pretty good.
No, we want that because if you show that to the public, then anybody who has Crohn's disease is going to want to know about that.
So here's another thing with Crohn's disease. We'll touch on this. The other reason why we're going after this, there's only one really prominent or known FDA kind of an approved product. It's for Crohn's disease. It's an orphan drug designation
Okay.
for Crohn's disease. For interlesional just means, bad ooky stuff that comes to the skin, right? Treatment of Crohn's disease with complex fistulas. So anybody with Crohn's knows what that word is. A fistula, we can give it's a clunky bad thing, right? A good example,
Well, it's
right?
in the intestines, and it
Right,
really
right.
destroys the lining, so you can't
it's bad.
absorb nutrients anymore. And
Unfortunately, more people know what Crohn's is an IBD than
Yeah.
should have to know because
Yeah.
it still is relatively new as far as
a lot of people know what it is. Yeah,
right.
I think so.
So that's called. It's got all sorts of different names, Darvestat, but it's called C as in Charlie, X as in xylophone, 601.
And that's
So
a drug
C-
that the FDA is approved for
It is
Crohn's disease now.
it is an orphan drug designation for people that are having problems with this one issue. And
Does it help? Does it do
I think
anything?
it's fantastic.
Okay.
It's approved in several countries. It's an orphan drug designation here. I don't know where they are with the status, but I think it's probably one of the best
But it
things
just
on the
works for one component of Crohn's, right?
Well, I would believe it works for many components of Crohn's. This is what the orphan drug designation is. So for an orphan drug, so people understand, fewer than 200,000 people are suffering from this or have side effects from something or something isn't working. And then you could qualify for an orphan drug designation. You still have to go through many of the steps. I got to do all the testing.
Oh, so this drug isn't being used yet?
It is being used,
It
yes.
is being, okay.
Yeah,
Not just experimentally.
So if you were taking the ABC, I don't want to go at these companies too much because they're bigger than me, but let's say you're using the ABC IV product for Crohn's disease,
Okay.
and you're having problems with your skin starting to fall off or something even worse, right? Growing a pig's tail, whatever. You're having bad side effects,
Right.
because you probably don't want that pig's tail, right? So that you would qualify for CX601. The way reimbursement is a different animal because it would be out-of-network insurance, but you could get insurance paid for, or a hospital might do it.
Okay. Is it expensive? Insurance doesn't pay for it? Is it going to cost?
No,
like-
they will if you qualify. Yeah,
Okay,
so
I
that's
got it, okay.
but that's not, we plan on doing the same thing. We also plan on going for what they call a BLA, which just means a full FDA approval.
But with your exosome product, right?
That's with a
Cresca?
adipose-derived stem cell product.
okay.
Cresca is also adipose-derived. That is an L2 Bio file, but we're taking a different approach than the L2 Bio. We're actually using first-degree blood relative donors. The reason why,
Okay. With Cresca you're talking about?
well, it's the L2 product, but they're similar, they're the same family.
Okay,
They're all adipose-derived stem cells, right? Kind of. Cresca is a little bit different. It's not really stem cells. It's a matrix of other things.
I got it.
L2 is just MSCs or stem cells. All right. So with that product, the reason why we're using a first-degree blood relative is if your child has Crohn's, or your brother or your sister, anybody that's a first-degree blood relative, or the person autologously could be the donor. Now, what happens there?
Legal. This is all just
It's legal, right? But what
compliance,
we
legal.
want to get a drug approved too, so that insurance will pay for it.
I got
'Cause
it.
Remember, when I was originally with the big anti-aging association, point of contention that I had, and they started adopting this, and other people agreed with me that regenerative medicine and anti-aging and these other kind of applications, they shouldn't be just for the richest 1 or 2% of the world. We see with L2 a lot of firemen and growing other areas because we try to
Firemen
keep
have
that
a lot
cost
of
reasonable.
problems, yeah.
Yeah, we see
Military and firemen, they're the worst, most toxic people we've ever had.
Right, and that's a challenge. They have all sorts of issues, and in the modern medicine, or I call it the disease management system. And I stole that from somebody else.
You mean allopathic medicine? So Crohn's, I mean, obviously it's in the gut. It's very different than IBS, irritable bowel syndrome,
It's in the
irritable
blood,
bowel
too.
disease. Okay.
Comes from the gut.
Yeah, thank you for correcting me. Also, will the product that you guys are kind of to get through the FDA help with IBS or irritable bowel syndrome? Well, so all that incredible,
it's in the
that
same family,
insane
so
autoimmunity that's
same
coming out,
family.
attacking the thyroid, causing lupus, causing everything
Yeah.
comes out of the gut.
So the home runs for adipose-derived cells.
So we could wipe out all chronic disease if it's autoimmune.
Well, I would go right at, say, autoimmune disorders.
Nice, that's huge.
So
That's
so
three-quarters
the
of
same
what we
the
see.
same data we're using, and this would be interesting to people, okay? Because if you have friends or anybody has any sort of autoimmune disorder, the same data and testing that we're doing that may bore you a little bit now may help all of you and your relatives and save a family member or a stranger or people
This
all
is
over
really
the world.
good stuff.
Autoimmune disorders are one of the biggest
I had
problems.
no idea your product was that close and that you had done that much research in that area.
Yeah, there are people that are happy now that wanted to kill me 2-3 years ago because of the money I spent. So one of the reasons why we sell. I mean,
I know.
I'm not supposed to be on the sales side, but it seems like I'm selling a lot.
Well, the public sometimes asks me, so what's the cost of that product? Or the labs are, unfortunately, with your situation, the labs are about $1,500 to $2,000. I don't know exactly.
Oh, these kind of tests are 25, 30
No, I know.
grand.
I'm just saying. And then you get, okay, so they do all that, and then you find out how much is the treatment? Well, that could be maybe $1,000. It doesn't have to be this much, but people are really sick.
So you just brought up something great.
And
Right
then-
now,
But what if they were healed, though, by that, and they didn't have to have their colon taken out, or they could work another 30, 40 years in a really good job making a decent
like my
amount of money?
nephew walks around with a colostomy
So
bag.
it's all reciprocal. We have to look at it. How much you're investing now to what you're going to get out
I
later.
agree 100%.
So that's hard to explain to the public. Well, I can definitely tell you, I had one patient, and I didn't even know at the time you guys had IND for Crohn's. I should have known probably, but I talked to your rep. He's a really great guy, and he kept calling me. He was very persistent, saying there's more exosomes made from your
They're exosome factories,
from the
yeah.
adipose-derived stem cells than any other. And I'm like, well, I don't know. I know I've been so kind of brainwashed with placenta, and I had good results. And these people, they're going to spend a good amount of money. And we did the Crohn's patient. She did 3 treatments. I did exactly what you recommended. And they could afford it, right? And now I haven't heard a word from her since. She's doing great. She's playing tennis. She comes in. She's doing weight loss, and she never complains about
it's
anything.
crazy.
It's like amazing.
I don't want to get in trouble here, but I think we're on to maybe one of the holy grails of medicine. But we'll find out.
All right.
We're going to prove it. All right. We're gonna do the research. We're actually doing the research.
Okay.
We're trying to get a trial approved.
Well-
but like for autologous purposes, and if you did the right things, the FDA says on page 3 of their recent guidance that marketing metabolic activity and systemic use of stem cells would be compliant, as long as it's autologous.
Marketing
or first,
what?
Well, marketing stem cells.
And those adipose cells are much more hardy, and they stay alive a lot longer.
Not even that,
And they
they're
don't
younger.
die as quicker.
Your body.
Well, how can they be younger than placenta, though?
Well, okay, so the placenta is not from the human body. And let's look at an umbilical cord. So how long is a healthy pregnancy?
I don't know, whatever the normal time is, like 9 months.
Okay. What do you call a 14-month pregnancy?
It's not very good. The baby's going to be really, really,
If it lives at all, right?
yeah, it's not going to be healthy.
What do you call a 6-month pregnancy?
Well, they're not supposed to be getting out of those placentas from those women. That's
Well, you're getting
we
a
were always
healthy,
told.
but you those just from a let's not make claims. Let's just use basic assumptions.
Okay.
So when you're harvesting a lot of those cells, a healthy one is at 9 months, just like we said, right?
Yeah.
Okay.
The
So-
healthiest would be
Right. So you're harvesting at kind of the end of their lifespan.
surest,
When they're designed to say, I'm done.
yeah, bye-bye, we're finished here.
That doesn't mean that stem cells create new stem cells. There's big words. I can get into the big words, but just say they create new stem cells. Okay. All right. So you could get some of those new cells, but the vast majority are going to probably be closer to the end of their life. I don't consider those the newest stem cell types. When we're taking these cells, they're locked away in time, and we are actually growing new cells, and they're being born into brand new cells.
Okay. Why and how are they locked away in time? What
That's
does
a
that-
great.
what does-
That's the best question you've had.
Okay, what
And
is
nobody
that?
ever asked me that.
It's just bizarre. What are you talking about?
Okay,
like
so
they're way underneath
do you
the
think your-
pancreas and you can't find
Do
them.
you think
and
your audience knows what HGH is?
human growth hormone?
Right.
Most of them probably do.
Okay.
Yeah.
So your body naturally decreases the amount to almost non-existence of HGH. Why?
When? What is
Well, as you from 8 years old up.
it gets a lot lower when you're in 60s, 70s, 80s. 'Cause I measure
Even
that.
in the
on every-
30s.
I measure IGF-1 in every lab.
Right. Well,
Sometimes.
IGF-1 is just an indicator. It's not a complete
Well, we
measurement.
can't measure HGH because it's so transient, or people don't want to spend the money on that.
But at 35 is the giant decline in men.
Okay.
It's a little earlier in women,
Yeah,
right?
I've seen it go down precipitously, even at 30 and 40. It's scary sometimes.
Right. So
80, 70, 80.
So overgrowth is a problem. Agreed.
Okay.
If you have too much HGH,
Yeah,
if you
it'd
had
be
the
like
same,
Frankenstein.
Yeah,
Your
like
jaw gets big, your hand. I've seen
look
people.
at the movie The Elephant Man is another scary one, right? That's an overgrowth.
Well, that's
issue.
not HGH though.
But it's still a growth problem.
Okay.
But when growth is out of control, it's a problem.
Right.
So your body slows down that levels. It's not because
Somatostatin, yeah,
I
there's
don't
a
want
lot-
Dr. Dana to be able to out jump Michael Jordan like he used to 5 years ago, right? You got that 49-inch vertical. I heard your wife told me. But we don't want that to happen, right?
Right. You want to be
So
normal.
with your body, it
just-
isn't God's plan to say we should kill everybody. We want people to get sick and stuff. No, it's to protect you.
Right.
The other effect is that we're only designed to live so long, so that it has some negatives. So now these adipose cells, a fetus is about 30% adipose. Remember, I gave that analogy. A fetus probably has 1,000 times more than a 40-year-old. They may have 1,000 times more than a six-year-old. I don't know. We've never measured it.
Okay.
And we'd get in trouble if we did, right?
Yeah, no, definitely.
So let's just follow that analogy. As you age, your body starts locking away these cells because you cannot grow. Do you have children?
I have one son.
Okay. So when your son was 1 year old, was he 3 or 4 times bigger at 4 years old?
I don't think so.
Well, what about 16?
I mean, he's normal growth.
But I mean, how
Yeah,
how
he's-
tall was he at
Yeah, he's
one?
much bigger than
How
one.
tall is he at 16?
16, maybe 5'8", 5'9". He's tall. He's 6'3" now.
Okay, so he's 40 or 50 times bigger than he was in volume, right?
Right.
In height, probably 5 times bigger. I don't know.
Yeah,
Is it
he's
1 foot to 6 times, whatever it is, right? So that you can't sustain, right? So your
Yeah,
body starts locking
correct.
these. It's a protection vehicle, and it what happens is it goes into adipose. It's one area where so they lock it in collagen, so it's like sits there. So that's what we're going
What's
after.
locked in collagen?
Those healthy young stem cells.
Okay, okay.
But it's to protect you from overgrowth. It's to protect you.
So if the stem cells just went rampant and were allowed to do whatever they want to do, they just grow out of control. Is that what you're saying?
Yeah,
You
I
get
mean-
all long arms, big nose, big head, whatever.
Sometimes I think it would have been awesome to have an extra arm,
Okay.
but I would have a hard time finding a suit jacket,
Okay, I got it.
right? That's
Yeah,
how,
yeah. No, I've seen Duncan Ross showed us a finger grew back on, part of
Oh.
a finger. He has a video.
Lots of things, right?
Video of it. So I mean,
So
obviously,
if you cut a liver in half, it grows back.
yeah, that can regenerate.
We're not doing liver.
And
stem
this is
cells
all
yet.
because of stem cells. So, okay, I got you. So they have to slow down the process. They have to
Right.
slow down these stem cells, and they lock them. So they're locked away. So they're in these little banks in the body, so they
I
can't
told
do
you Duncan
anything.
was smart. He's growing back fingers, right?
So you can't do anything. And so what you guys are unlocking those stem cells and then harvesting them
Yeah,
and growing them.
yeah.
Wow.
And it's
So they're
it's a-
dormant. They're not old. They're not
Yeah,
young.
we're not using a
They're-
bioreactor. We're not forcing the expansion. It's kind of a natural incubation.
So they're
process.
dormant. That's
So I mean, that's the basic part.
amazing.
The Cresca,
That's so cool.
Cresca is a matrix that we bring off of
love
this.
it.
That was designed to enhance fat grafts. Because
That's all it was in the beginning?
Yeah, it still is. That's still what I want to go after with. It's just it has all these other things it does.
I know. It's amazing.
I mean, it's like a miracle.
Right.
But it's very expensive to make. We don't have a lot of margin. It's really kind of a passion for us. And then the trial has evolved, and we got a
How did you
really
get
good
into
team.
all this stuff in the beginning? Because you're not.
So I met these two doctors from Chicago, from somebody else. I'm from Chicago originally.
Okay.
I hate
Dr.
Wicked.
Loeb?
No,
somebody else?
Ronald Klatz and Robert Goldman.
Oh, A4M.
Yeah.
Okay.
And then we have a long history together.
And what were you doing there? Were you a
All sorts of
marketer,
stuff.
entrepreneur,
Oh,
just a
geez.
businessman? Or
Who knows?
Why were you in science then?
Well, I started writing.
Why don't you go into economics? I mean, what?
My original background is finance. I mean, I started writing, and
okay,
I have a minor in physics. I mean, I understand
I
measurements.
got you. Okay.
But I mean, we
Okay,
started,
good.
we started hanging out, and then I started helping them with articles, and I was writing, and we did a bunch of different things. But what I did is I got to meet a lot of doctors like you, and I started hearing, so many different concepts, and I started looking at it as kind of a business, and I realized this is a horrible business because you need all this money and there's no guarantees. And then I started, my God, Dr. Dana makes sense now, and Dr. Bob or Dr. JoJo is crazy, and you have to filter out the crazy and the good.
Right.
And I'm a little
that's
cynical
cool.
in nature, so I challenge things, and now I'm less cynical. But I've been around this long enough now that you start learning, and then I have a really good team that helps me look more intelligent. a lot of PhDs and doctors like yourself.
Thank goodness for that.
Yeah. I mean, Dr. Loeb was at he was the head of pediatric
Yeah, talk
surgery.
about Dr. Loeb a little bit.
He was the head of pediatric surgery at St. Jude's for 23 years.
And what does he do at Cresco? He's the CEO?
Well, he's the
or-
medical director of Cresco. He's the medical director of L2 Bio. He was our medical director on the trial originally, and there's other doctors that go back. There's 100 knees and stuff that we worked on before the trial was
Right.
approved, et cetera.
Right.
And pre some of the rules that came out with the FDA, so we were allowed to do some things early on that you can't do now, and which is a big advantage. But that's for being like one of the first on the block. We had those advantages, right?
Right.
Still expensive. Everybody else was putting the money in their pocket. I was taking that percentage and shove it in this stuff. At the time, some people were upset with me. Now they're all thinking, oh, that was my idea, right? That's the way it works, right?
Yeah.
So that's how that all evolved. But Dr. Loeb was that, he's done more stem cells for cancer than anybody I know. He's treated more kids with autism than anybody in definitely in North America.
Really?
And with success.
We would have never known.
He has kids going to high school driving that were never supposed to drive.
Were they like catatonic? Were they that bad?
They couldn't go to the bathroom by themselves. One of the first things that we see, I thought he made this stuff up because I didn't know, and I challenged. He's like one of my good friends,
that's
maybe my
amazing.
best friend, probably my best friend, definitely my best friend. And he's like, Vince, the first thing they do is take a big poop, and I'm like, you're full of shit, Dr. Loeb. He goes, no, the kid was full of shit. Now he can poop on his own. He's actually very funny, right? But the reality is it's true, and I start finding this stuff out. Some of these kids are so inflamed and so have so many issues that like kids that are just experiencing early onset or in puberty, they can actually become violent for it until they get used to it.
We had kids that were violent. I was very blessed. When I first started in this industry, because I was sick myself, I went to a place called the Princeton Bio Center. Princeton Bio Center was run by Carl Pfeiffer. Carl Pfeiffer in that time was taking the, not autism per se, that came later, but he was doing the schizophrenics and the bipolars. I mean, really serious patients, because we'd watch them come from Earth Center, and they'd have all of them come in, 10 of them sitting there, and they were definitely not normal. And he was taking them and looking at orthomolecular medicine like Abraham Hoffer did. They had a lab that measured tourmalines and things nobody ever knew of, and they were pulling them out of their brains and were looking, analyzing them. They're getting them back in the workforce. They had to take multiple minerals, vitamins, and things. So anyway, what came after that was Dr. Newbrander came. I guess he was there when I came in. And Dr. Newbrander was credited as finding the methyl B12 shot for the autistic kids, that whole pathway that was broken down. But you could only get it at one pharmacy, Hopewell Pharmacy in New Jersey. And he took so many kids back because of autism. So in the very beginning, we were starting to see those kids come in that you guys are treating now. So we could see how serious they were. So if you were lucky enough to have Dr. Loeb as your doctor, you may or may have not gotten chemo and radiation, you might have survived.
Well, St. Jude's is ahead of the curve. I mean, listen, when I said John Hopkins, I said they may be the best. Well, you should possibly, there's an argument. When you look at pediatric surgery and innovation, there's, if you ask most people, they would, I guess, know who St. Jude's is. So it's a good credential. Then he's head of UIC and he runs Chicago's.
What's the UIC?
University of Illinois at Chicago. It's one of the largest medical schools in the country. He's the head of pediatric surgery there, and he just recently took over Loyola.
Wow, really?
So there's a pediatric surgeon shortage. Okay. So, but I mean, that's one of our partners. We have really great people.
Anything else you want to tell the public about?
So
what hope? Give them hope. I mean, you already got a lot of hope.
I think the era of autoimmune disorders is going to be treated. Let's just say we can't cure it. I think we're going to.
Put in remission, at least? To put in remission?
Well, not even just remission.
So people can have a normal life?
I believe that we can do this safely. Look, so let's go back to the basics. So I'm going to start with that. First comma to do no harm.
First do no harm.
So if we can give something that doesn't have these horrible side effects and can even be similar to some of these other products. Yes, maybe we can get lucky and cure people, put people into remission, which we've seen, okay?
Right.
My nephew is a great example. That I think that's ahead of the modern medicine system right now.
Well, I don't know what...
And if we set up this trial to be every 3 months, and hey, Dana, what if insurance would pay for it?
Well, then you got it. That's serious.
I mean, because people
amazing.
can't afford this. You know that.
A
A lot of people
they
can't.
need that. They need that, yeah.
Yeah, and I would love to help everybody.
I mean, we're helping a lot of people with naturopathic medicine. We're doing a lot of what you're doing even without the regenerative medicine. It's been done for probably the last 50 years with the herbal medicine, the homeopathics.
We have a supplement that basically started
all the
L2
different
Bio.
things we're doing.
I think is better than most stem cell treatments.
Really?
Called Zombie Dust.
Well, I want to know about it.
I'll give you a bottle.
All right. I want to know about that stuff.
We won't do it today, though.
No, I'll help my patients with it. Well, listen, it's been a true blessing to have you on the show. I think we got a really good slice of what's going on in the regenerative medicine field, and just to know you have those products coming soon, especially for Crohn's. So many are suffering.
And
that's a blessing. Thank you.
And natural organic fillers. So we'll have a fat-based
Oh yeah,
filler.
let's talk about that.
So we're going to have an extracellular matrix. There are a couple products on the market. One and another one's being introduced. We believe ours was a little better, but they're similar.
What is it now exactly?
It's an extracellular matrix made from adipose.
And what's it going to do?
It's going to act as a filler in your body. It causes areas to grow, so you make it some permanent.
Instead of Botox or instead of the
Yeah, I think
plastic,
it used to be-
fillers we're putting in your face.
I think the market is the hyaluronic acid Juvederms of the world.
Okay.
You know, I like those products. They use listen, I'm going to make this easy for people. Most people know what super glue is. I still think of the Gorilla Glue sticking to that
me too.
guy's head, sticking to the wheel in the hard hat,
Yeah.
or sticking to the ceiling.
Yeah.
So, but I mean, that's called BDDE. That's what they use to cross-link and hold these things together. In smaller concentrations.
In the body?
Yes.
What?
So plastic surgery is held together.
The same thing?
Here, let me
What
give you.
super glue is made of is it derived from
Let
the
me give
human
you something
body?
that'll interest your audience, and you may not know, but most plastic surgeons know.
Okay.
Plastic surgery is held together by super glue and plexiglass. BDDE
Those
is
sutures?
a cross-linking for some of these fillers.
Wow.
They use super glue, but it's lower combination. I'm making it
Well, it
kinda
has to
funny.
be, right.
In plexiglass, some of them use PMMA, which I like to PMMA.
I've heard of it.
But that's actually the combination of plexiglass. Now, in smaller combinations, all this stuff is safe. But what if we have an organic solution that may cause permanent growth? So maybe you have a filler 2 or 3 times in your life, and that area is
Will not grow too much, I mean, right?
well, yeah, unless we don't like you. Then there's like we could have one this size, and
Right. You'd have to tone it
we
down
got
a little
lopside
bit.
some people for fun.
Get some somatostatin in there.
Hey, the
okay?
people that we test for free, they have to sign a release. Can we put a giant bump on your forehead? Right? And they usually sign it because it's free.
Come right out of here. Big horn.
Right, a big horn. Would
No,
be
we
cool.
have enough of those already. We don't want to make any more.
No.
All right. Thank you for coming in today.
Hey, it was great talking to you. I really
you.
had fun.
Thanks, appreciate it.
Bye-bye.